Lovely to be here. Thank you very much for the introduction. And it's great to be at this event, mostly because no matter our background, corporate, investor, startup, we have something in common, and that's that we have two passions, technology and healthcare, which is absolutely amazing. Now, I already had a chance to meet many of you, and we've discussed, and I said to, okay, let's do a little research, and let's see what do we think about health dashboards? Can they provide actually patients with a comprehensive view of their health? And I asked this question many of you and many of the other attendees of these amazing events, and we didn't really get to a clear answer, and the responses were very much conflicting. And I'm also on the same page, and as someone with background in digital transformation and already in the healthcare sector for some time, I have a couple of dashboards on my own. And these just some of them, but based on everything I'm tracking, I can see my exercise, steps I'm taking, my heart rate, my sleep, my temperature, what this means about my hormones, how I take food and drinks based on my glucose levels, and this is just for, let's say, 12 to 24 hours. Now, if I go even further, I also have my electronic medical record, my genetic testing, my GlycanAge testing, and you can already see how this picture gets messier and messier, and there is so much things we're tracking. And now if I ask you, am I healthy, am I in good health based on all these metrics that we're tracking, I bet that you may need a degree in data analytics to try and make even the slighter sense out of all these data. And to be fair, I don't think anyone is surprised, and we've never measured as much data as we're measuring today. We have every 2 in 5 adults in the US is actually owning a wearable or a health app, and we have 380 wearable devices that are measuring more than 7,500 physiological and technical variables, and we call those digital biomarkers. Now, this is definitely a lot, and some of those biomarkers definitely won't be as useful as others. For example, if I look at the number of steps I took yesterday, this won't really tell me much. But we also know that phone sensors, for example, are very, very good at detecting and diagnosing depression, even much better than daily mood questionnaires. So definitely the potential is great. Now, what's even more inspiring and reassuring is that technology has revolutionized how we understand something way more fundamental and how we gather insights from something way simpler, and that's a simple drop of blood. Now, thanks to the technology advancements, we can diagnose a lot of diseases from simple drop of blood. With some biomarkers like astrocytes, which are star-shaped brain cells, we can accurately diagnose Alzheimer's. With others, like glycans, which Zori has talked about a bit before, we can actually detect and diagnose more than 70 diseases, even a decade in advance, which makes them very, very powerful. But the thing is that we actually have more than we need. We are measuring so much that we can rarely make sense of all of the data. This is especially a big problem for patients. They will often claim that really they want more, they want to see more and more information, but they rarely know how to make sense of all this data, especially some very, very simple insights around sleep, exercise, food intake. For practitioners, the challenge it remains, but it's a bit different, and it's often concerning their time and their capacity. They will very rarely have time to go into thousands, okay, not thousands, but maybe hundreds of different health dashboards, assess their accuracy, and then make sense and connect the dots of all this data. And this is further reiterated and driven by our healthcare systems. And what we know is that our healthcare system rarely incentivizes physicians to do prevention, and most incentives come for treating diseases, which is where doctors inevitably spend most time. Now, in business, we often talk about one metric that matters. Now, we know that in healthcare, that's a bit too ambitious. Our bodies are just too complex. We can't come to one metric. But what we also know is that we need to look at all this data that we are now gathering, make sense, take learnings, and then maybe come to one dashboard that matters and make sure that everything we need to see about a patient is available at one place. The question now is, what should be the metrics that will be featured in this one dashboard? And we already know that some of the metrics that we rely on are flawed. Such is the case with the body mass index, BMI. We have a healthy range for BMI, which is internationally accepted. We also have a growing number of studies that confirm that people with a bit higher level of BMI actually have lower risk of death. However, the standards haven't changed, and most physicians around the world still use and rely very much on BMI. We also know that there are new and advanced biomarkers, such is the case with glycans. We talked about glycans a bit before. We will talk a bit later again. But what we know is that, well, glycans are very effective, but they're quite new. They're not enough, doctors are not familiar enough with them. They're not widely accepted. And then it comes again to a challenge of, should we measure only one or only the other or both? And how do we make sure that it's not too much? Here comes really a new framework that most of you most probably are familiar with, and this is P for medicine. It stands for prediction, prevention, personalization, and participation. And basically, while this is just a framework, it signifies our shift as healthcare practitioners, healthcare people working in a healthcare industry, but our shift towards prevention from just disease treatment. And now what we know is that our decisions about what we measure, how we treat patients, and how we work with patients should be driven by these 4 Ps. We also know that this very much comes back to also the only miracle drug we know so far. And sadly, or maybe happily, the only miracle drug is lifestyle. We know that most of the deadliest diseases currently can be prevented, and many of them can even be prevented through good lifestyle that works for every individual. This is 80% of heart diseases, strokes, and diabetes, and 40% of all cancers. So definitely the potential is great. And this potential is what's driving us at GlycanAge to develop a biomarker, which is the GlycanAge biomarker, and an at-home simple test that can help you measure your current health, predict your future health, looking at your risks of developing any of those diseases, and then making personalized choices that will make you an active participant in your own health journey and will empower you to actually make decisions that will help you live healthier for longer. Now, this all sounds brilliant and very, very optimistic, but the challenge remains, and is the challenge we faced at the very beginning of we can't really come to just one biomarker. We just have too many. We have too many dashboards, too many metrics. And to show this even further, I would like to finish with a story. And that's the story of Adele. So Adele is a client of ours, a patient of ours. She is a 53-year-old. She is very successful in her professional life. She is a mother, wife, and she's also a bodybuilder. So throughout her whole life, she's been very, very meticulous about her health. And of course, as many of us do, she has a lot of devices, and she's tracking a lot of data daily. So when looking at her sleep data, her exercise data, everything looks great. When looking at her blood work, simple blood work, minerals, vitamins, nutrients, everything looks great as well. And often people tell her, well, you look younger than your age, you're like in perfect shape. So she decided to basically try and confirm that with the GlycanAge test, and she was absolutely surprised when actually she saw that her GlycanAge result is higher, which meant that there is some chronic inflammation in her body. Now, glycans actually showed that the problems could be in her bones. And after this revelation, she went on a very, very long journey to try and understand what's the real problem. And throughout this whole journey, she felt very much alone, despite the fact that she was visiting many different doctors, doing many different blood tests, and not only like all the different examinations. But she was the only person having this information, all the perspectives. And she felt that she's the person who has to make sense of this and find a diagnosis, which of course she couldn't. Eventually, as she was very persistent, she got to the diagnosis, which was myeloma, a very early stage of rare bone and blood cancer. And she was happy and relieved that at least she knows what's happening in her body. And actually, while this is a story of a disease, it's also a story that tells us that the potential is very, very big, and there are many reasons for optimism. Because we're just starting, and we're just starting adopting all these new tools and devices that were enabled by technology. And now give us more time as we all work together towards making this prevention possible and taming all this technology to the best of our abilities. So let's join forces. Let's definitely discuss how we can all work together. And I'm sure that we will be able to take tech and health forward. Thank you.
Thank you very much, Vladi Mihaylova, CMO at GlycanAge. Thank you for a great performance. You're doing an excellent job.